Hello, hello, hello. Hi there, my ATHLers, friends and family. How are you today? I just thought about this topic on Sunday and I decided I was going to come on here and talk about it. I wasn't sure if I was going to be able to make it today. That's why I didn't make any announcements, but we are here. Hello again. Before I start, how was your Valentine's Day? Hope you guys all had a good time and had a fun time with your significant other or had a fun time with yourself. Like I said before, Valentine's Day is all about how you choose to make it. So, for those of you be joining me tonight, I say happy Valentine's Day and sorry, call coming through. I say happy Tuesday, and for those of you who be joining me later, I say happy Tuesday, and thanks for tuning in. Let me just turn this off because the phone's gonna disturb me here. Alrighty. So, before I do that, because I took the reason why I have to switch this over to my other forum is because I'm on StreamYard, and StreamYard you have to give permission in order to comment on the group page. So that's why I usually just wait until I come on here, and then I but then always there's a kind of delay when I come on too. So I'm just gonna go in here. Maybe one more time. You guys should be used to this by now. I'm so sorry. Alrighty, so I'm gonna go in there. I usually just put it to my group, and then later on I put it to the other groups. So there we go. And one more. And I think I always have a sniffles whenever I come on here too. So alrighty, so we'll go here and there. Okay. Alrighty, so I'm sure a lot of people won't be joining me tonight because, like I said, late notice. But anyways, I am on. The reason why I chose to do colon cancer awareness is kind of jolting just from coming from talking about Valentine's Days because I saw this meme going around. I saw about those who were performing on the Super Bowl that most of them were in their 50s or early 40s, and and meme was going around saying if you recognize the people on this picture, that means it's time for your colonoscopy. So I'm gonna try to see. Let me show you the meme that was going around. Hopefully, I don't mess up my screen here because I'm gonna show this here. If you see that, it says here those are the people who perform at the Super Bowl. For those of you who are my age group, Generation X, and people younger too, you recognize those people. So they're saying time for a colonoscopy, but and then usually you'll be thinking that people who are in the 50s or early 50s, but you also recognize this person. That's our lovely Chadwick Boseman, who was the great Black Panther. He died of colon cancer at age 43, so he was nowhere near 50. Okay, so I'm gonna do that. Alrighty, so I am back. So I decided to talk about it because colon cancer is very pervasive now, and the CDC changed the guidelines stating that they want everybody to do the testing of 45 to 50 if you're average risk, meaning that you don't have any first degree relative that have colon cancer or have colorectal cancer. You can do that at age 45 to 50. And for those of you who have family members with it, depending on when they were diagnosed first, you want to make sure that you do that at least 10 years prior to when they were diagnosed. But for most of us who come from different family members, different culture backgrounds, where people don't talk about why they were, they had any kind of illness, that's something you're going to have to talk with your family members and talk more about and see what's going on. So it's very important if younger person, ask your mom and dad, actually like a relative who you trust and say, what did this person have? Can you please, because the fact that it's a hereditary disease also. So please, that's something you want to talk about. So before I do that, let me just first start again for introduce myself formally. My name is Abby Tyler. I am a family nurse practitioner, and also I worked in the hospital for 22 years. I work in a private practice right now. Drexel University graduate. And for those of you who go into the nurse practitioner school, I don't know if they're doing it now, but somebody, University of Pennsylvania, I think one of the alumnus donated like 125 million for the NP program, so you can go to it for basically for free. And I think those who are graduating, if you choose to, if you consent to work in a undeserved, underserved population. So if you want to do that and get all your tuitions paid, that's even better. So I just thought I'd bring that up to those of you who are interested in. So if you call and get more information about their programs. Okay, so let me just see here. I'm just gonna start before, so I'm gonna put my glasses on. Okay, so let me start. Quick disclaimer, like I always say, whatever I say here, recommend or advice and all that. This is all based on my practice, this is my education, and also CDC guidelines and the American Cancer Society. Also, so whatever, do not make any changes to your regimen until you speak directly to your doctor, your provider. Okay, so again, our topic tonight is colon cancer. So, colon cancer is the third most common cause of cancer in the United States in both men and women. It is also the third related cancer-related death when you put men and women combined. Women, you talk about breast cancer and other gynecological cancers, and also it's estimated that 52,580 people will die from colon cancer alone this year. That is a lot of people we're talking about. So, you say, what is the risk factors for colon cancer? Anybody is at risk mainly, but like I said, your average risk is when you have no family history, no personal family history of it. And they say mostly occurs for, it used to be for like an older adult, but like the picture I showed you before, most people are getting it, most people are being diagnosed. Majority of people have been diagnosed after age 50, but most of people, we're seeing an increase of people being diagnosed before age 50. So that's, like I said, the CDC guidelines now is from 45 to 50. And some people, again, if your family member had it, a first degree relative, like your, excuse me, mother, father, siblings, and all that, you want to make sure you make your doctor aware when you're doing your screening, your initial doctor's visit. And when you go back for anything, and if anything changes in your family history too, you want to bring it to your doctor's attention, to your provider's attention, so that way they can make sure that they're screening you effectively and they know about it. Because when we ask you the questions, you have any family member colon cancer? Do you have anything? And when were they diagnosed? And all, we ask you all that, so we make sure that we get you in there to get you screen time in a timely fashion, so they can get you and make sure get you detected and treat you if they have to. So, like I said, the guidelines is 45 to 50. The risk factors, again, like, if you have family history of it, first degree, some of it also go in second degree. So, like a aunt and uncle, the grandmother. There's also those who have you test you for Lynch syndrome. That's like the high genetic component where make you a higher risk of getting the disease. Diet is really high in red meat, excessive alcohol consumption, colorectal polyps, that's the pre-growth that they catch before it turns into cancer. And those with ulcerative colitis, those are all inflammation diseases that run in your that go in your intestine area. That if you have also colitis, you'll know that. And Crohn's disease, those are all inflammation disease. So inflammatory diseases that chronic, and you spend a lot of time visiting the doctors, and some people end up having surgeries and other things. Sometimes it can be very debilitating, sometimes it can be disabling also, to where you may not be able to work for a long period of time or become disabled because there are frequent attacks, and it's so limiting when you have frequent attacks that you have to be in the hospital or take certain medications, and you can't do certain jobs because you can be exposed to so many different things. Going to put you on steroids, and you can be exposed to so many different things in the air that may cause you to become sick even more, because your steroids, when you're taking the steroids, that also affect your immune system. So those are the risk factors. It's not comprehensive, but those are the main risk factors. So we're talking about that, and we move on to symptoms. So for your symptoms, each person is unique. Okay, so the symptoms may vary. Some people have no symptoms at all. Okay, like go back to the actor, well, actually Will Smith. Everybody know who Will Smith is. For those of you who don't know him, he was on the Fresh Prince of Bel Air. His wife is the one that's on the Red Table Talk. And for the younger generation, that's Jaden and Willow's dad. He took the colonoscopy, I think it was last year or the year before, because they're seeing a lot of men. He trying to get a lot of men to get their colonoscopy and try to show that it's not scary, and especially for black men and for black people too. He was trying to bring that awareness of that. So he went ahead and he took he had a colonoscopy, and he was fine. He didn't have any symptoms before he had it. And I think like a week later, when they called him with his results, I think it's usually 48 hours, they called him and they told him. And so they said, we found some growth in there, which is called the polyps. This is little things that they find along the intestinal tract, and they usually and they said if you had waited maybe 5 to 10 years from now, you would have been like full blown colon cancer. So because they found the polyps, they took it out, and so would tell you, your GI doctor would tell you that you have to return at least maybe 5 to every 5 to 10 years, depending on the severity. And all they'll tell you, your GI doctor can explain that to you and tell you specific on how they want you to return. And like I said, again, based on your history, your presenting symptoms and all. So you're presenting symptoms for symptoms. When you come in, like I said, everybody is unique, and you may not have no symptoms. And like the story I just told you, abdominal pain. And now, if you have abdominal pain, maybe here today, don't panic. Oh my God, I got pain, I got pain. But when it continues over a period of time, usually we tell people if it continues and it start affecting your life, then you want to go to the doctors. It could be anything too. So most of these diseases, that's the problem, is some of the abdominal pain can mimic anything. If you have the pain right below your breast area there, it could be something like reflux. If you have it, if it's going up for women, it could be GI, cardiovascular issues, because heart attack symptoms appear differently in women than they do in men. So it could be anything. So don't think, oh my God, I have colon cancer. You want to make sure you go and get it checked. And you want to make sure you go and get it checked, because especially if it's continuing and it's more frequently affecting the way you eat and all that, you want to make sure you go. And if it's really excruciating, you really want to go to the emergency room. Okay, so you don't want to wait, because the most important thing is we want to make sure we rule out any kind of heart issue. Like you're not having a heart attack, then we can move on to everything that's not emergent after that. Okay, early satiety, meaning when you satiety, when you're eating, it's like you get full very easily, you feel bloated very easily. You be like, usually I used to be able to eat, and now as soon as I eat a little bit, I'm so full. Whatever it is I'm eating, I just feel so full and all that. That's not normal, and that's not normal. So you want to make sure you go to your doctor for that. Unexplained weight loss, okay, and loss of appetite. So you're not eating too much of your breakfast, you're not eating too much of your lunch. Like you're not, if I ask you, are you completing all 3 meals of the day? If you're the kind of person who don't eat 3 meals of the day, that's different. But if you're eating all 3 meals, like your breakfast, lunch, and dinner, and you're not eating because you just don't have any appetite to eat, even though you prepare the food, but you have no appetite to eat, and if it's your favorite food, you just don't, you're not eating that much, you take a little bit, you don't feel like it, you want to go there. You want to check with your doctor too. I want to say provider, because whenever I say doctor, I take away the PA and the NP. So just force of habit, that's something like we have to learn. Unexplained weight loss, like I said, if you're not, you don't find yourself exercising seriously, you're not on a diet, you're not doing anything to lose the weight, and you find yourself losing weight, people say, first of all, people start saying, oh, you're losing weight, and they'd be like, oh, okay, yeah, maybe I was exercising, maybe that's what's showing now. But if you start noticing that you're losing weight a little bit more, and your clothes are fitting a little loosely, your pants are fitting a little loosely, and you notice if your face was fuller before, you start noticing it. And usually a face would be like almost like one of the first one starts showing, and then you start noticing, you want to make sure you go, especially if people start saying you look like you're losing weight. Yeah, so you want to make sure you go unexplained, like I said, not unexplained, unintentional weight loss. That means you're not intending to lose the weight, but you're losing the weight anyways. And you can, of course, you can, why am I losing this weight? I don't know what's going on. I'm eating healthy. But if you're exercising and trying to lose the weight, that's different. If you're not doing that, that's something to be concerned about. Chronic constipation. Usually, not everybody has a bowel movement every day. Some people have the bowel movement every other day. Some people have the bowel movement twice a day. So you want to make sure that any changes in your bowel movement over a period of time. You say, usually I go maybe twice a day. Usually I go in clockwork. I go this time. I go this time. But I've noticed that I'm more constipated. I've noticed that I have to be drinking a lot bit more food. If you're constipated, sometimes we tell you to eat more fruits and vegetables and all that. And I find myself when I go to the bathroom, it hurts so much when I have to move my bowels. So there's something going on there. And also diarrhea too, because sometimes there's something that could be blocking, it could be different. It could be hemorrhoids. It could be, so it's not necessarily cancer, but it's something that's blocking the stool from coming down. And so the stool is like leaking on the side of it. So whatever is blocking it, you want to make sure that they get that checked. So you can say, oh, I'm having diarrhea here and there. And I took celeperamide. I'm using a generic name. But for some reason, every time it keeps losing. And then when I go to the bathroom, I'm not putting out that much. I'm putting out these little, sometimes when you finally do go, it's like these little thin you go in with. So it's like, A regular person is not supposed to be going. Like they tell you, your bowel movement is supposed to be like an S because your colon comes down like that. So it's supposed to come down nice and smooth. It's supposed to be nice and brown. It's not supposed to be dark. It's not supposed to be watery. Darkness, dark stool also just signifies that you have blood probably somewhere there, and that could be a problem too. So you want to make sure you get that checked. So that's the same thing. Well, bleeding in the stool, when you notice that there's bleeding, when you wipe yourself, you notice blood on the toilet paper. When you look in the toilet, do you notice blood? Because we'll ask you that. Do you notice blood when you wipe yourself? Do you notice any blood when you the toilet paper? You want to do that. Um, Fatigue, because usually if you're bleeding somewhere, your body starts, you need the blood and the oxygen and everything to keep the body going. So when it's not going and you're losing blood somewhere, you're gonna feel tired because your body needs the blood and oxygen and the iron to keep the body pumping. And if that's not happening, you're gonna start feeling tired. You'll be like, I've been trying my best, I've been doing everything, but I can't get over this fatigue. Now, also because of COVID and all that, could be part of either acute COVID, meaning you're probably sick from COVID, or you have the COVID, you've just recently had it, and you one of those people who have long-term long COVID where you have issues. So you want to watch that and then bring it to your doctor's attention. Okay. Nausea. You feeling like, and if you're a woman of childbearing age, if you nausea and all that, you want to make sure that you're not pregnant. That's the first thing we're going to ask you. When I say woman of childbearing age, I mean anywhere from 9 to 55. 9 because most girls are seeing a period at age 9. They shouldn't be pregnant at that age. But we ask from age, from if you're a person of childbearing age, we try to rule that out first because there's so many complications that can go on if we're doing anything and we don't rule out pregnancy first. Okay, so we're going to ask you that. We're going to do the pregnancy test first, and then we're going to go on from there. Now, some medications can also cause intestinal bleeding, intestinal aggravation, that can also that can lead to bleeding in the stool. So you could be taking like aspirin, you could be taking and most people take ibuprofen for pain. Anything that's like steroids, that can also aggravate the stomach lining, and that can cause bleeding. So that could be that too. When you come, we're going to ask you all those things. Have you taken any different kind of medication? Are you on aspirin? Are you on anything that would cause your stomach to bleed? Anything like that? Then all those things. Like I said, we look at your presenting symptoms. We get your family history. Remember a couple of months back, I did that HPI thing. What the kind of questions we're going to ask you? When did it start? How often does it occur? What makes it worse? What makes it better? When does it happen? Any family history. So we ask you all that in order to come to a diagnosis. Sometimes the diagnosis, once again, the diagnosis could be a differential diagnosis, meaning it could be so many, maybe 3 or 4 different diseases that's causing that symptoms as rectal bleeding. Okay, so basically we'll say, okay, you may be having that. You may be having, it could be hemorrhoids, it could be the medication induced, it could be from other diseases you already have, family history in that. So we'll try to do that, like I said. The most important one first, we want to make sure your heart is okay, and then we go on from there. So we're actually about those medications, and that doesn't mean please do not go out and change any of your medications again without talking to your family member, to your provider first, because somebody might say, "But then why are they giving me this medication when they know that it could cause me to bleed?" But again, there are some medication where they rate the risks and benefits, and then if the medication is causing like severe side effects, you want to bring it to your doctor's attention, and they may change it or change and do other therapies. Okay, so don't stop. Speak to your doctors first, because if some people on aspirin, if you have your blood is thin and other reasons, so you don't want to stop that, because you want to make sure you keep your blood nice and thin, so it doesn't cause a blood clot and you have an issue. Okay, so I said I was going to do this. I'm going to just check to make sure there's any questions that I have to answer before I wait to the very last there. Let me see here. Okay, yes, yesterday it was nice and quiet. I worked to that, and I hope your days was better too. And let me see where we used to say, "Hey, lady, thanks for the sharing health knowledge with us." Thank you, and thank you so much for your support. Let me see here. So I'll go back. Let me just take this off there. Okay, so we did the symptoms. Now we're gonna go to screening. All right. So again, screening, like I said, it starts at age 50, average risk, and 45 for higher risk people. But if you have first degree relatives, again, you want to find out so you can get tested 10 years prior to. And this is not like an old person disease. Anybody can get it, but and we've seen a lot of people with it now. Okay, so the purpose of diagnostic testing is to look at the areas where that might be cancerous, determine if and how far the cancer has spread, and also determine if the treatment is working effectively. Now, there are many there are other ways to do the different methods, screening methods, diagnostic methods. So, like the diagnostic colonoscopy, that's the main one where you have to go to the doctor. Usually, if you come and you're saying you're having rectal bleed and other issues, I will probably say go send you to the GI so they can have a colonoscopy, or they can determine if they want to do a colonoscopy or do the stool test first, because that means you're symptomatic of something, and waiting to do the regular test that you do at home may not be beneficial to you. So we'll send you to the GI doctor, and gastroenterologist is actually a gastroenterologist, which is a GI because it's cuter. But so they can do that. The main two ones that we talk about, like I said, is the colonoscopy. It's the one where they take the little holes. They give you light sedation, so you're not wide awake while somebody's putting something up your rectum. So they go up in there and got the camera, and they're looking there, and they look up all your colon and everything to make sure. They also look at your rectal area too, because the colon is all the intestines and all, and then the rectal area is the last part that comes down to where you have a bowel movement. So they look up there, making sure anything is not there, and then because of that, they'll see that when they look and see little growths. Remember, I told you about the polyps. Those are little growths that appear in little lining of your colon. So they stay there, and they take a couple of years to grow. So if they can catch it earlier, that way you can come back and check again, and they can take it out and make sure you're fine, and you'll be good. And they'll tell you follow up in 5 to 10 years from now, so we can keep an eye on it. They would, when they take the polyps out, of course they'll take it to the lab, to the pathologist, and they'll check it for the biopsy it to make sure that you're going to be okay. So let me choose here. Alrighty. And then the other one that we do, we tell you in the office, is there's two different tests. Like I said, there's other tests that you can do, but the GI doctors, usually the ones we talk about in the primary care, is the one I'm going to talk about. Okay, so we'll do the stool DNA. Like I said, I think you see the commercial on TV. Sorry. It's Cologuard. That's the one that we use. That's the most popular one that you see all the time. And there are other ones too, but that's the one that most doctors' office use. Where they send it to your house. So we'll talk about it in the office, where when the stool's coming down. Okay, it picks up the DNA from your colon. Okay, so when we send you the package, we'll register you, and then also the company will call you and explain it to you more. They have like 99 different languages they can do it in, and they'll send it to you, and they'll tell you you're not touching anything. You're not touching anything. You just go in there. They have the whole container together. You just set it over the commode. You have your bowel movement. You take a look. You just put it, because it has a solution in there. You cover it up. You put it back in, and you send it to the testing center. When they do the testing, they will send the results to us. They won't send it to you. Some other people, like the lab places, you can call and get your results ahead of time. They don't do that, because people freak out if you see stuff and all that. So no, you send it to us first, and then when we see that, if it's negative, we'll tell you it was negative. You're good to go for 3 more years, unless if you have symptoms during that time and you come and let us know. But so you'll be good for 3 years. Now, if it says it's positive, don't panic, because it doesn't mean you have colon cancer either. Remember, I told you there could be other reasons why you have it. So usually because of that, we'll tell you, okay, this is what it's showing. It showed us a little bit of blood. It came back positive. Okay, so it's picking up something that's in your colon, so they want to get that checked. That's when we'll send you to GI, and then GI can go ahead and do the diagnostic colonoscopy. And then based on that, they can follow up and do whatever needs to be done based on that. Like I said, it would take out the polyps if the polyp is there, and they will send it to the lab, to the pathologist, and they check it out. If it's not cancer, you're good to go 5 to 10 years, depending on what they said. And if it's positive, then if God forbid this cancer, then they'll tell you the stage is like stage 1 to stage 4. Stage 1 is the least amount, stage 4 is the worst one. So you want to make sure that but it's best when they catch it at very stage 1, is that's like a very high chance when they catch it and you detect it and move. That's a very high chance, say up to like 92% of 5-year survival rate. So you want to make sure that if we see that there, we send you to GI. You want to make sure that you follow up. Please do that. Okay. Alrighty, so I'm just gonna take a little break here because my throat is slow dry. Alrighty, so as we get to this point, let me see what any comments there. Please break it down for some of us due to cultural differences. Can you just specify what you mean by that, Jackie? Break it down from cultural differences. If you can just write that in there, I'll get to that. Okay. All right, because I know I'm speaking to like different cultures and all that. So let me go to where you're saying, okay, we have some old people watching. Oh, okay, okay, alrighty. For okay, if I'm speaking to an audience, a non-American audience, and I'm assuming it's not going to be just Liberian people or just African people and all, but you want to make sure like everything I'm saying here, for those of you can understand it, please explain it to your family members. If you have any blood in your stool when you go, especially most people don't look, they just kind of flush the toilet anyways. But if you notice there's any blood on the toilet paper, you want to bring that to your doctor's attention. But it's important that everybody gets screened at age. They're saying that even 40 to 45. Some are saying 40, they're saying 40 to 45, 45 to 50. So anywhere between there, between like age 45 would probably be the ideal age to get started getting tested. If you have a family member, first degree family member, mother or father, um, siblings, you want to make sure you get tested at least 10 years prior to when they were diagnosed. Okay, so you may not know that, but you knew that they have colon cancer, and you knew, you can pretty much remember when they, say, okay, I remember I was this age when they got sick. I remember, and so sometime around there, and they might say, okay, so they probably got sick. They told you when they were maybe 55, so maybe age 50, or they told you when they were 50, so age 45. So, but the ideal age right now is saying recommended age is 45, anyways. So some doctors will do it like anywhere between 40 and 50. Okay, so just as long as you go ahead and get tested. All right, let me see where let me just saying. Okay, I think I went back to the risk factors. The risk factors I said, it can be diet high in red meat, family history, alcohol, excessive alcohol consumptions, colorectal polyps. There's some things that just grow in your body, and sometimes, and people just have it. So it's like not real. You can really narrow it down to exactly what it could also be: radiation exposure and other, but there's so many different factors that cause it. If you have any kind of ulcerative colitis, if you have inflammatory diseases of the bowels, things like that, Crohn's disease, those are the things that are high risk for getting cancer. So that would be like risk factors in your causes and all. Okay, I hope that answers the question somehow. All right, so I did the symptoms and all that, and I did going back to how you screen. So the other one where there's two different tests. I did the one where they send us to the DNA. There's the other one where they can do in the doctor's office, where you take that. It's almost similar to what you do at home. To you take that and they can do a doctor's office, take a stool right there and put it in the solution, and then send it also, and they can do that. And then the other one where it's the card, because it's called fecal cord blood, whereas the card where we in the hospital, when you're in the hospital, we take the when you have a bowel movement, we take the container, we take the stick thing, whatever it's called, and we take one part of the stool, we put it on the card, smear in the card, and we take the opposite side. So if you have to do that at home, you take the opposite side of the stick, the spatula, and you dip into that, and then you put that there. Now most people will be like, oh my god, nope, 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 I'm not touching my stool, I'm not touching my stool. Okay, no, that's why there's different methods. And then also, but just imagine you're going to be uncomfortable for maybe what, about 3 to 5 minutes, and everybody has seen this stool. You're supposed to be looking at your stool anyways, by the way. You're supposed to be looking at it every time, looking at the color, looking at how it feels and all. If it, like I said, it shouldn't be really hard, and you shouldn't be having diarrhea. So for 3 to 5 minutes, or even 10 minutes, you're gonna be like, oh my god, this is so disgusting, oh my god, this is so disgusting. That's okay. Just imagine, just for 5 to 10 minutes, you can be uncomfortable, and then before you know that would save your life. So 3 to 5 minutes discomfort and something else that you have to worry about for the rest of your life, or something that will shorten your life, So even with a colonoscopy, people are like, oh my god, there is no way. And the prep to get, they'll take the, you have to drink the medication, and because you're supposed to completely take the medicine to where it's like completely drains you out to you have like no more stool left in you, because they have to be able to visualize your colon effectively. If you go there and it's not clean, they'll tell you, nope, not clean enough. We have to do it again. And so you don't want to do that again. So you want to make sure as much as you can to make sure that you drink everything you're supposed to do. Some of it tastes like, oh, but like I said, discomfort for a little bit and knowing that you could be saving your life. So do that. Okay. I'm gonna go, yeah, one more question before I go to that. The reason being is, Jackie said, the reason being is that they are afraid to tell family members before. It is. I mean, it's not something that you want to talk about. And plus, even when you do see that, you get very nervous. You're like, oh my God, what if this is going on? What if this could be the fact that I may be dying? Or does this mean something that's going to affect my life and affect my family's life, my livelihood, and all that? Do I want to do that? So, but it's afraid. You don't want to talk about it, but it's important that you bring it to their attention. And just you can talk to somebody who's like a trusted family member, or somebody, a family member who that's in the health field, and say, this is what's going on, and I just want to run it by you first before I bring it to my family member. Do that. At least that way you're going to be talking to somebody else, and the person can say, oh, when you go see your doctor, so you can say, I want to go see my doctor. You go there and just say, okay, between me and you. But if anything, especially if you're an elderly person and there's something that they have to bring you to the doctor's office, take you to the GI doctor, um, so the person who's taking you back and forth will have to know. And sometimes it's comforting to know that, okay, I know what this person's going through, and I don't worry them too much, but I know what they're going through. At least that way I can help them in this journey. And don't forget, the other person, your family member, that once again, that becomes part of the family, their medical history. So you want to make sure that you do that. You tell them. It's not an easy conversation to have. I understand. I understand that, but it's something that you just put it aside and just say it. Okay. Let me see if there's any more questions here. Lucy said, are people who suffer from hemorrhoids most likely to have colon cancer? Not necessarily. Not necessarily. There's some people who just have, hemorrhoids, and that can go from this. So not necessarily, but it's something that you do want to get checked, because you could be thinking that you have hemorrhoids and it could be something else. Like I said, there could be like the mass, we'll call it the tumor, that could be up in there and a little bleeding, and you thinking there's your hemorrhoids, and you're putting preparation H, and you're doing this and you're doing that, and it's not healing. So usually we'll tell you, eat something light, get some Metamucil or some Miralax, because you want to make sure your stool's nice and thin when it's going down, so it doesn't aggravate the hemorrhoid and doesn't inflame it. So if it does inflame it, and sometimes you can go to and get that checked and get the hemorrhoid taken out, because there's some people who have hemorrhoid right at the rectum, and there's some people who have hemorrhoid further up. And sometimes the hemorrhoid is like completely lodged into there, and that can cause severe pain. So if that is the case, and once again, if you don't know which one it is, you want to make sure that you go get checked. Okay, so if you have changed your diet, eating more fruits and vegetables, and you're taking some Metamucil, eating more fiber foods like the Benefiber, the drink, and all that, and that seems to be helping, okay, that's fine. But you still want to continue with your screening, your annual screening, not annual screening, but the screening, age specific screening, in order for that to be to make sure that maybe it's just hemorrhoids, and we can do this to help with the hemorrhoids, as opposed to it could be something else that any delay could cause additional issues. Okay. So I hope that answered. Let me see here, and I'll do that before I get. You're welcome. Okay, this is such a great topic. Thank you for sharing today. Oh, thank you for watching. Just because I saw the Super Bowl thing, and I'm like, let me bring this up. It is not colon cancer month, but as always, diseases don't pick a month. But just that in the health field, we try to limit something and try to bring more awareness to it at that time. But whenever I get like when I see like a major thing going on, and like everybody's attention is focused on that, that's the time you want to make sure you get that, all right, and get people in. So I did the screening part. I think I did that, your colonoscopy and your stool DNA test. And there are other ones, like I said, CT colonography, endoscopic rectal ultrasound. Your GI doctor would go more into that. Usually, like I said, we talk over about the one you can do at home if you have average risk and higher risk the colonoscopy to make sure you are fine. And sometimes you don't know anything of that too. When you go to the hospital for other reasons and we do your blood work and we find out that this is what's going on and we say, wait a second, your hemoglobin is really low and you must be bleeding somewhere there. So usually that's when we start checking if you're female, are you having very heavy periods, you have fibroids, you have like other reasons why you'd be having like really heavy periods, you just have a baby, something else going on, and could you be pregnant and miscarrying? You don't know that. So want to make sure we look at that. For men also would be checking that, and then the next thing would be like, okay, let's do a cold blood. And while you're in the hospital, usually we'll do that. And there's anything with concerning, then we get GI on board. But when you come to primary care, where I'm the provider, this is what we tell you first when we get your history, and then we go over it. Okay, so we would go to, just moving my things around here. Nice, my little paper. Okay, so prevention. Prevention is like pretty much, the most important thing is knowing your risk factors. Like I said, your risk factors are your average risk, meaning nobody ever had any colon cancer in your family before. So your average risk usually would do the stool DNA test where you can take home and then follow up from there. You want to make sure you eat healthy. I mean, want to eat food less in red meat. I mean, people eat, we eat a lot of food with red meat and all. You want to cut back on that. Like I said, everything, introduce seafood into your diet. Unless if you have like gout and things like that, you want to kind of watch on that. But most people introduce more seafood, less on the land, more from the sea. Okay. And, for us, we eat everything from the land, and everything in the zoo, we eat it. So you want to make sure you cut back on that. If you're smoking, cut back on your smoking, and most important thing, try to quit, because smoking can be very addictive to that. Can also lead to other issues besides just that anything that causes colon cancer. Early screening, early screening, early screening, early screening. If you don't take anything away from what I said tonight, early screening. Okay, go to your doctor's office tomorrow if you are age 40 and say, if you have somebody in your family, bring it up. Not you call and make an appointment, of course. And then also you're saying, I was watching something that said some, and it mentioned colon cancer, and I just want to be concerned because I think on Chadwick Boseman, he wasn't 50 years old. He got diagnosed. By the time we found out, he was already, nobody even knew. He was already stage 4. He had been fighting it for so long. So he had gotten, tested long before that in the early 30s. And most people are even thinking of that in the early 30s or late 20s. That's not something you're thinking about. So just imagine this young man that had all of this, and he was such a sweetheart, to just be taken away, just like that. That was really, really painful, because his future could have been so great. He influenced so many people, not just one race of people. He influenced so many young people in this world, and to just see that. So you want to make sure that you can work on that so you can be healthy too. Okay. Important to follow up. Okay, so just make sure you're doing that, because the point is, some people are like, they'll tell you, oh, come back in 3 years. Oh, I was fine. I don't want to do that. Or maybe they saw something and I'm too afraid. No, I don't want to do it. Like I said before, if their thing is cancer, it's not going to go away. It's going to remain there, and it's going to get worse later. No, there are also some times where they look at something and they say, we want to do additional testing, and it's fine. You're good. Some people say, oh, this, the doctor said this, and God said this, and I was praying, this happened. That's fine. You are entitled to your religious beliefs and all that. But when it comes down to it, you want to make sure you say, okay, I prayed and it went away. Okay, that's good. If that happens, that's good. What if you pray and it didn't go away? What do you do then when you're sitting there at the doctor's office and they're explaining to you that what you were supposed to take care of now has gotten worse? So I don't profess to know all the answers of religion and all. I'm not even going to say that. When my patients, when I'm in a hospital, when I used to be there, they say, you want to pray with me? I'll say, let's pray. I'll say, I'll do my part. You do your part. God do his part, and we'll go on from there. And the doctors did his part, and everybody go on from there. Okay, so just make sure I've taken care of priests, I've taken care of nuns, I've taken care of pastors and all that, and they pray and all, and they go to have their test. Okay, so it's not like I'm just going to pray and everything will be okay. Sometimes things happen, sometimes some things don't. I don't know why. So my thing here is to talk about healthcare. Okay, and again, like I said, when they find the polyps, they take it out, they send it to the lab, make sure it's not cancerous, and they tell you, come back and you'll be fine. And for those of you, like I said, with pre-existing conditions, other issues like your colitis, irritable bowel disease, and all that, inflammatory bowel disease, and all, you want to make sure that you're seeing your GI doctor and they're telling you to recommend it, whatever screening. You want to make sure you follow up with that. Okay. So I think I've covered everything so far. It's not, I mean, it's scary to think about, but at the same time, it's so much better that when you get tested early, that you get screened early and catch it very early. Okay. And I'm not saying, yeah, I'm not one of those people like, oh my God, okay, it's like I'm age 40, I have to go get tested now. And I'm following up and everything. Of course, as human beings, we're gonna delay on certain things because, like I said, sometimes there's no symptoms. There are no symptoms. People just go ahead and get that, and the polyps itself, they take ever to become cancerous. So there may be no symptoms for many years. You may be like, I'm fine, I'm good. This person had it, and you don't know. You may have it. So why not get it checked now? So most important thing, early screening, early screening, early screening saves lives. Okay. You want to get tested. If you have know your family history, eat food high in seafood. Get your testing all the time. Know your family history. It's very important to know your family history. Wash your stool, make sure it's nice and brown. It should be soft. You shouldn't have diarrhea. You should have to make sure you're not getting full too easily. Watch your weight. If you're not trying to lose weight and you're losing weight over time, remember now, especially when you're losing weight over time, it's not just colon cancer too, it could be any other cancer. All right. You may say, oh my God, I lost like 2 pounds, and that's fine. But you start looking when you go into the doctor's office, or especially if you're getting on, and people start noticing that your clothes are fitting a little bit loosely. At first, you won't know the difference. You'd be like, "Oh, look at me, I'm all," but eventually, you start showing, and you're not eating that much, you're feeling full too early. You also want to make sure, as a female, you want to follow up with your GYN, because you want to make sure it's not gynecological cancer, because once again, ovarian cancer has no signs, and it's very hard to any kind of test for a screening, because whenever they do the test, and that's when you're already diagnosed, way the stages are higher. So if I don't have any more questions, let me see. There are any comments? I was trying to get this other 30 minutes, but it's such an important topic, and I didn't think I was going to go this far. Thank you all again for the questions. I hope you guys can read the questions and also learn from that. I think I got everything. So thank you also very much for those of you who are watching now. I say thank you. For those of you who will be watching later, I say thank you. Please, if you can, share this video on your page, share this video to your different groups, and also people can see that African Americans also are higher risk of getting this disease. Also, not mainly also the fact that, like, the access to healthcare and all, and the fact that they may not, when they do that, they may not follow up that often. So it's not usually because something in our DNA. Everything is, they're still working on so many things. There's so many theories out there. So, but as always, you want to make sure that you get checked as often, and please follow up. Okay. Once again, you know, check with your family doctor, making sure that you're getting all the screenings that you're supposed to get. Women getting your sex specific screening, and men also do the same thing. Eat healthy, eat healthy. You always want to eat healthy and exercise. You want to make sure that your immune system is very strong. So if you get into anything, that strong immune system and all that can help you. If you get any kind of disease, it will help you fight it better. Because when you're strong like this, you have your army all waiting. When something come and attacks you, of course they're gonna, you're gonna be stronger to fight it, as opposed to when you're not. And not everybody can be as active as they want to be. There are other people who have other issues that they can't be as active, but as much as you can, go ahead and do that. Okay, so I thank you all for watching. I'm sorry that I kept this on for so long. It's like almost like 45 minutes. Wow. Okay, so thank you all, and good night and good luck. And I think I got everybody there. Just on the Cooper said thank you, thank you, thanks for watching. Please share the video. Please share the video. This is a very, very important topic. Okay, thank you, Musu, thank you, Jackie, and thank you everybody else who I didn't identify on my screen there. I will talk to you guys later. I won't be on Friday because I have an event that I have to be at, but I'll be posting other things, and I will answer any more questions if you guys have it. So thank you all. Good night. Good luck. Enjoy. Stay warm. It's so cold for those of you in cold areas like me. So All right. So I will talk to you guys later. Bye bye.